Hey, I'm Ryan Steller with Standard Care. This is Mike Martinelli, and we're going to share with you a couple of items from the healthcare news this week that we thought were interesting. First one, I'm going to just chat briefly about Elizabeth Holmes of Theranos and update to her case, and then some really interesting statistics that have come out from a study by the AAPA about the burden of healthcare on adults in the United States. A couple of quick updates on patient rights and privacy, particularly as it pertains to data and data breaches. And then we wanted to close with something we found really interesting that is not directly related to healthcare, but talks about adoption and the state of adoption of AI within healthcare. And it's a piece from the design firm IDEO about what we think is a surprising trend and how Gen Z thinks about automation and simplicity versus, kind of the dominant generation in industry right now, which would be Gen X and millennials. So to kick it off, Mike, did you have a chance to read this New York Times update on Elizabeth Holmes?
I have a different article. I read one from the Guardian.
Oh, okay. How did they report on it?
I don't have a New York Times subscription, so I can't really access this one, but it was thorough enough. It was good. It was like an update on what was it? Saying that she must report to prison. And I got a BBC one also that gives some more background on the case.
But what did they say? What did you find interesting about the articles?
So this Elizabeth Holmes, what was interesting is how charismatic and entrepreneurial she is, and that she's able to convince these big shot investors. I think one of them was like Rupert Murdoch, and then some major well-renowned scientists to invest in her blood testing platform, which she claims to be able to test with a simple prick with a small amount of blood for a variety of different ailments, including certain cancers. And and it turned out that these claims were patently false. It wasn't the case at all whatsoever. And she wasn't using any novel technology. She was actually just using machines and tech leased out from other laboratories that already exist. So the fact that she was able to get that far and then before this came crumbling down was pretty interesting.
Yeah, I guess it was Bad Blood was the book, and I think it was also the name of the Hulu series, the TV series from 2017, 2018. And it talked about, told that whole story. And, oh no, that was a different one, different Bad Blood. From when it was more recent, I guess. It was probably 2020. So based on the Carrio book, John Carrio was a New York Times author, or Wall Street Journal author, broke the story originally. Publication date was, I guess, May 2018, and then the series came out after that. But yeah, they're basically just using traditional lab testing equipment instead of this breathtaking technology. And then, so the update this week is she's had this ongoing court battle in San Jose, California, and I think the meta story was a lot of people wondering if her superpowers of reality distortion that worked for, lying to investors for a decade around this blood, what is a very concrete thing, which is blood testing, was going to work in her court case and she'd be able to escape jail, right? And
using superpowers to escape jail. Yep.
Yeah, like this, this like dark Steve Jobs power of just somehow like fighting a court case, which I think the consensus is that she's definitely guilty, and it's like because there's not just white collar crime but also material bodily harm. A penalty is due. So anyway, so the gist is she's going to jail. She's going to serve time. I think Sunny Belwani, her ex-boyfriend and co-conspirator, whatever, I think is also going, and that's it's kind of good news, right? Like it's she's I don't know, it's tough. Like there's we need more women in like STEM in general, so like she was a role model for that, but somewhere along the way, the cult of personality that she was cultivating was just not kosher, and there should be consequences for that.
That's the overarching general moral of the story here. Yeah.
All right. So Elizabeth, get your shit together. Come back next time. Martin Shkreli did his time. He's back on the scene, so he can. I don't know if that's a good comparison, but if you do your time, maybe you get another shot later. We'll see. Next, this article is from AAPA, which is the American Association of not physicians, but physicians' assistants. Or physician. I'm sorry, American Academy of Physician Associates. Okay, is that like a physician? Maybe they want a different term now. But anyway, the study was put out by the Harris Poll, and this study has been quoted a lot on like LinkedIn and stuff. So there's a lot of different takeaways, I think, from this. But just some of the stats: 73% of U.S. adults say healthcare system fails to meet their needs in some way. 71% worry that the demands on healthcare providers are too great. 68% are concerned that healthcare workforce shortages will impact them as a patient. An equal proportion are concerned that the shortage will impact their family and loved ones. 66% of adults feel the healthcare providers seem more rushed. 30% say they felt rushed during an appointment. The statistic that kind of jumped out at me was the headline stat that they use, which is U.S. adults spend 8 hours monthly coordinating healthcare and find the system overwhelming. So that's like, it's both so obvious that it almost doesn't need a study, but at the same time, the complete lack of consumerization in healthcare and crafting it into something that's easily accessible suggests that there needs to be more evidence, I guess, to get people have the power to change it to change. I don't know. Did you have a chance to skim this article?
Yeah, I skimmed through it. Mostly all the stats that are provided. And honestly, none of it was surprising to me. It's just like, oh yeah, here's a number to slap on kind of what we know already and probably experienced firsthand. And that last stat, the 30% that they feel rushed during a healthcare appointment. If I had to guess, 9.8 out of 10 people probably experience that. Like if you're in a major healthcare system and you're going in, if it's just a wellness checkup or an annual cardiology appointment with your cardiologist, you're gonna, if they're part of a major health system, a major academic system, for example, they have a lot of pressures on them. One, like they have the hospital administration who does not have, for the most part, they're not MDs, they're not PAs, they're not NPs, so they don't have that clinical background. They just have the business knowledge. They're like, okay, we need beds, we need more beds, we need to keep these beds filled. If there's a bed that's filled with a patient and we're not getting enough, we're not being able to charge enough for them to get more reimbursement, let's find a way to get them out and discharge them. But that's also the same for outpatient, like volume of patients you see in one day. That's how, the system is able to charge and get reimbursements for, the more volume, more patients you see in one day. So they have that pressure from the administrators, and also there's the payers. For example, commercial insurance providers. They do most of them have like MDs, like medical professionals or former retired medical professionals, like in their C-suite, like executive and director level people, but not, who are looking at claims. So there's these. It's almost as if the hospital administrators and then the payers are like, those are the puppeteers, and and then the physician or the NP or the PA is the puppet, and they're telling them how to practice medicine. Oh, the payer says, okay, well, I don't care about your clinical judgment. If you want to, if you believe this patient needs to be referred to for open heart surgery, you need this test A, test B, test C, test D, and you need to have results within these range in order for us to say, okay, we will pay for that, for that surgery. And then you got the hospital administrator saying like, oh, we need more volume. If you're not going to be seeing enough patients, in a given day in the clinic, we're going to hire another person to come onto your group who will see more patients, and then which translates to they're taking patients from you, or like or say you're a hospital owned group and you're trying your best to practice ethically and spend time with your patients and not put them in unnecessary procedures. But they're like, oh, you know what? There's this private practice, this private group of the same specialty, for example, cardiology. We're going to give them like half the ER. So because we know that they're going to send everyone to the cath lab, and it's just like the physician's hand, healthcare professionals and practitioners' hands are tied pretty much at this point. Like they could barely practice medicine using their own autonomy and clinical judgment.
Yeah, I think that's one in the past decade or so. I think one of the things that's being on the vendor side of healthcare, building products and life sciences for healthcare. I think the new thing is the physician burnout as an unmet need that people are talking about a lot more. And I know a lot of these dynamics. Matt, who's not on the call today, who works with us, is a former physician and then moved into health tech, and that's why is a big part of it. One of the things that's interesting about this study is there's definitely like a political dimension to this, I think. So it follows up with data. I won't quote all the statistics, but basically unanimously stating that physicians, associates are, safe and effective care, make it easier to get appointments, expanding quality. And this came up, this broader theme around staffing ratio, staffing efficiency came up with some investors, some later stage investors that I've chatted with this week. It's definitely a place where they're looking to deploy solutions, and it's unclear if those solutions will be tech or if they'll be tech-enabled services, probably more tech-enabled services, but we're kind of waiting on AI to save all of us. So maybe AI soon. All right. So next thing that came up, so a topic that's near and dear to our heart is, and relates to the previous one, is how data is handled in patient privacy. And there was two cases that kind of hit the headlines or the LinkedIn sphere this week. One of them was an app, and the other one is one of the larger providers, technology providers in the health IT space, NextGen, an EMR company. And I don't know, Mike, did you have you and I talked about these extensively? Would you, I guess, starting with kind of the inside baseball more, the NextGen, what did you think of that case? I think it was originally published out of Maine. It was an action by like
the Maine
government
AG.
in Maine.
Yeah. So I mean, so states, just as a general matter, each state could have their own types of privacy laws as long as they're they're not, they can't obviously preempt federal law. Typically what the deal is when it comes to healthcare regulations, specifically, and this isn't just for healthcare, when the federal government enacts regulations for healthcare, say, for instance, HIPAA, the HIPAA regs, privacy and security rule, in terms of how they relate to the state, states, that's like the minimum standard. Like you have to comply with the HIPAA regs, the privacy rule and the security rule regs as a minimum standard. When I say minimum, that means that states, they can make health data privacy regulations like that are like HIPAA, but I mean not HIPAA because it's not the federal government, but states can make them more stringent as long as they don't like veer off of like, what HIPAA is about. So that it makes sense that if you have a state that has more stringent health data privacy and security laws, that you'd see it come up in their state AG's office first, and then of course it will come up in the federal government for HIPAA enforcement.
I didn't. I should pull it up. Did you? What are some stats? Just to the. Okay, so it sounds like the breach. It was a breach, which means the data got out. Impacted over 1 million patients. So I guess this is nationally, and it was confirmed on April 28th of this year, so about less than a month ago. And it included 4,000 Maine residents. So the company disclosed that unauthorized individuals access personal information such as names, birth dates, address, and social security numbers. Okay, so the big one was in there. And the health tech vendor breaches are becoming an inevitable risk rather than a mere possibility. That's definitely true. The question is no longer if such a breach will occur, but when. And then the author, this is David Chu, who's a contributor to Forbes, wrote this article originally, so shout out to him. And it goes into I think some things that are pretty actionable and correct. So he talks about educating staff, understanding your partners, so who you're building this technology with, incident response planning, so when the stuff happens, having a plan around that. And I think it highlights something about security, which is security is often runs directly against user experience, and then you have to really have a culture that values the extra time going into maintaining the security. Otherwise, you're not going to have security, most likely. And hospitals rightfully, I think, really focus on care in patients, and they're literally dealing with death or kind of like emergencies in front of them if they're a traditional hospital with an emergency department. And, they're not nerding around with security. So this stuff is kind of prone to happen. And then there's parallels. So the other article that was interesting was this pre-mom thing. And I know we've talked about this. We got quoted in Axios, and in fact, Axios reported on this as well. So I thought this was very interesting because it represents something that's probably way more common than most consumers realize. Do you have the stats on that?
I don't have the stats pulled up, but I could give my take, a brief background. And
yeah, I know you had read it more closely than I did.
Yeah, I just forgot. I meant to keep that tab open. But so Premom it's a fertility app which users can use, and it collects data to help its users determine when they're when the right time, the best optimal time is to get pregnant. So that would fall under the category of a wellness app. And in the recent years, we've seen a huge uptick in these wellness apps. And what those are, when I say app, it's something you can access on your phone, your smartphone. The thing about this is, so when I say wellness, that's kind of an important term right there, because that means that even though the data that they collect and use is health data, and this is what the creators of wellness apps are thinking too, and are aware of, or in some cases that's why they're trying to move toward the wellness route as opposed to an actual medical software, medical device, is that that data in a wellness app is not PHI, protected health information, that is regulated under HIPAA. So a lot of people, if you're making a wellness app and you know that it's not PHI regulated under HIPAA, you might have the false impression that, oh, okay, I don't have to worry about privacy as much because I'm not going to get fined for I'm not going to get CMPs for violating HIPAA.
CMPs being
yeah,
penalties.
civil monetary penalties. Yeah.
So this is I mean, I think zooming out a little bit, the FTC has always had the ability to drop the hammer on this stuff, but they haven't done it very much. And then Premom and then I think Flow app, another like period tracking app, are getting fined like almost one after the other. Like, the government moves pretty slowly. So it's kind of like one FTC action after the other is focusing on this, women's fertility stuff. And it seems like it's very likely correlated with protection around abortion and privacy, different state level legislations around outlawing abortion, and then even going.
Oh, I see. Yeah. So the issue with that is, in addition to so they have the data and they're using it. Like, that data is valuable. It's worth something. So you could sell it to social media platforms and use other analytics like Google and stuff. That the thing is, you could have like all smartphones, unless you have turn it off and you're very careful about this, have you could get like geotagged where you are. And that's what the Axios article mentioned, is that you could be, when you're crossing state lines, the geo-tracking aspect of that data, like wherever that data was collected, it has a geotag on it. So that is
location data PHI, or is that just personally?
No, that's not PHI at all. Nope.
Okay. All right. Super interesting. All right. I'm gonna wrap on that. Any other points on that one that you thought were key?
Just that, yeah. Even if it's not PHI, it's health data. The FTC it's used in commerce. It's commercial. These are commercial matters. The FTC could fine you under the health breach data notification rule.
Gotcha. Okay. And then lastly, I wanted to share something that is not really directly related to healthcare, but it's kind of a general interest story, and I think it's lighthearted because it talks about the ongoing cultural battles between generations, and that is some research from IDEO. IDEO is the famous design firm out here in Silicon Valley, very influential with Apple back in the day, and they publish thought pieces and research and that kind of thing. And the assertion of what they're making here, the statement that they're making is that the desire for simplicity and thus automation peaks, in their observation, with Gen X and millennials. And then when they do research with Gen Z, the Gen Z actually likes to figure it out themselves, which is, I guess, surprising. It's almost, it might be a little, and maybe even intimidating, because it's kind of like, maybe we, as Gen X and millennials, we've been lulled into too much, too much expectation of technology in a way that might end up kind of hanging ourselves or something. But it's relevant because in our business and in healthcare in general, like AI, particularly very powerful large language models and generative AI, are moving in rapidly. And healthcare and hospitals have avoided AI as much as possible, for the past decade or so. And it really just took something that was absolutely powerful, like undeniably powerful, I think, to change that. And something that also had the breadth of usability, not just a narrow predictive ability, but kind of generative ability, like for notes and for prior authorization or whatever it was doing. So this is really interesting because if you're a doctor today practicing, you're at least a millennial, if not older. So we're I don't know. I just thought it was an interesting trend. IDEO is cool, so I thought it's cool to talk about what IDEO is talking about. Did you get a chance to look at it at all?
Yeah, I skimmed over it. in terms of like when you said like Gen Z has the tendency to want to do it themselves. I've seen a lot of things. Maybe this is what I was referring to, that doing it yourself, that can mean so these days I've seen news articles and stories about this. You could just, these kids in school, like high school, could just go on chat GPT, and even in college, and then have it write an essay for them. And I saw this graphic one time that says how to use chat GPT to write an essay, and that avoids plagiarism. And there's like this 4 steps of how to do it. Like, so if you call that doing it yourself, then I mean, so it's, you always have the argument that the AI is going to take certain jobs, but if people who are going to school to learn certain skills to have a certain job during the course of that education aren't doing the educational exercises and the work to learn that skill, they're just having AI do it. It's kind of like almost like you're given into it. It's like a self-fulfilling prophecy for AI. Like you want to get the skill, but you're using me AI to build the skills, or say on a piece of paper that you have the skills that I'm going to be able to do better than you anyway. So
yeah, education is definitely upset by this. So I'm just quoting the article because it's a powerful quote directly from IDL. What emerged based on their research, quantitative and qualitative, was a strong consensus. AI is a helpful tool for boosting productivity and efficiency, particularly for school, career development, and daily routines. Yeah, I bet. And then, but also discovered a profound ambivalence over the role of AI should play in 3 specific domains. And I think this is the negation of where it should be, and the habits that might form, and then I guess kind of the social patterns that might form by this negation, which is creative expression, human relationships, and mental well-being. And the mental well-being is an interesting one because generative AI has been positioned a lot as a solution to the mental health crisis. So these are all, it goes on to say, these are all pillars that are fundamental to identity formation and self-perception. So I would say, and the quote they have is, I love being deeply connected to my intuition, one 19-year-old said. So I think that's really powerful. So it would be really interesting, like as a millennial, if our generation ended up alienating ourselves by being too reliant on simplicity and ease, and then had this relatively more competent Gen Z following us, maintaining critical thinking and perception in a way that we forgot and lost. But all right, awesome. All right, thanks for your time, Mike. We're going to wrap up. Thanks for listening. We will share some of these links in the show notes, and please reach out if we can help in any way. See ya.